Good morning, everyone. This is Maya. I'm from TMC for Seniors, and we are so pleased to have Dr. Lee Ryan with us here today. Dr. Ryan is a professor and the department head of the University of Arizona of the Department of Psychology. And she's also the associate director of the Evelyn F. McKnight Brain Institute and the director of Cognition and Neuroimaging Laboratory. Lee has a special interest in the impact of cardiovascular health for maintaining memory function as we age and decreasing risk for age-related disorders such as Alzheimer's disease. We're streaming live here today from our Facebook pages as well as our YouTube page. So you may be watching us on either one of those formats. If you have a question during the presentation, please leave them in the comments and we'll try to answer those questions at the end of the presentation today. There have been many stories about the effects of social isolation during the pandemic, and I know our audience would love to learn ways that they can maintain a healthy brain and a healthy lifestyle during COVID-19. So Lee, welcome. I'm so glad you're here with us today.
Thank you very much, Maya. Thanks for the invitation. So thank you for that very nice invitation and introduction, and it's great to be here. This is the new norm, right? I'm giving talks on Zoom, and this is my first time in this format, but it looks like it's a great one to get out to everyone. So thanks for joining us today. As Maya said, I'm a clinical neuropsychologist. So I work with and have worked with individuals with various forms of brain injury and brain diseases like Alzheimer's disease and Parkinson's for really my entire career, which is getting pretty close to 30 years now. But I also am a researcher, and my big passion is to understand the aging brain and how we can really continue to maintain a healthy brain and therefore our memory function and our other cognitive functions throughout our entire lifespan. And one of the things that I've studied a lot and thought about a lot is the relationship between the heart and the brain. So what I like to say is that if it's good for the heart, it's good for the brain. So over the last 10, 15 years, we've really come to understand that the things that impact our cardiovascular system, our heart health, also help to maintain our brains. It means that people who can have a healthy heart are going to be less likely to experience cognitive problems as they get older, and also they have a decreased risk for developing Alzheimer's disease and related kinds of dementias. So this is a hugely important topic, and it's really become even more important during COVID-19. So what I normally end up talking about are things that you can do to maintain your brain health and heart health, like controlling hypertension, like maintaining a really healthy diet, getting sufficient exercise every week. That doesn't mean you have to go run marathons, but doing some moderate exercise 3 to 5 times a week is really good for all of us. And it helps not only our heart, but our brain. But what we're talking about now during COVID-19 is really something quite different that I think more people are experiencing, and that is social isolation. The connection between social isolation and brain health is, you have to talk about a couple things in between there to understand why being socially isolated would impact our brain health. The first thing is that we know that isolation increases stress. It is one of many kinds of stressors, and every one of those stressors we know increases risk for cognitive problems as you age, and also for developing Alzheimer's disease. And there are lots of stresses in our lives, the loss of a spouse or loved one, having financial problems, not having adequate access to health care, being a caregiver is a huge part of what drives stress, particularly for those of us older people who are now caring for our moms, as I am, in our house. It really adds to our overall stress. And one of those additional stresses that we're seeing in much larger numbers now during COVID-19 is the stress from being socially isolated. And what do all these stressors do to the brain? Well, what we are pretty sure that it does is that it drives up inflammation. The inflammation in the periphery, in your body, is why stress is not good. Continued chronic stress is not good for your heart. But that also has an impact on the brain. So continued inflammation in the brain will set up this kind of environment in the brain that makes it more susceptible to all the kinds of mild damages that we see associated with aging. But also it sets up an environment where pathology associated with disorders of the brain, like Parkinson's and Alzheimer's, can kind of flourish. So inflammation, chronic inflammation, is a bad thing. Short-term inflammation is good, right? It's a response of the body to an insult, right? Just like COVID-19, the virus called SARS-CoV-2, if you are exposed to that, what your body does is it responds with inflammation, and that inflammatory response is the thing that hopefully fights the virus. But sometimes, as we've seen with people with COVID-19, and also with these chronic long-term stressors that we're talking about right now, is that the inflammation starts up and for some reasons that we don't really understand, it doesn't settle down. It doesn't go away, even when the virus, for example, goes away. When your body's gotten rid of that, the inflammation continues. And we think that's how stress affects the brain through inflammation, and that social isolation is one very important component of the stressors that we're experiencing. And so we've known for the last it's really become a big topic for the last maybe 5 years, that we understand that people who are experiencing social isolation are more likely to experience stress. They're more likely to have all kinds of issues, such as concerns with their heart and other organs. Your sleep is disrupted. But we also know that those individuals who are chronically isolated are more likely to experience cognitive impairment and are at higher risk for dementia. So it's one of these big, a big interactive kind of bundle of factors that we think drive brain aging in the wrong direction. So what can we do about it? Yes, all those other things that I mentioned are really good for you still. Keep maintaining a really good diet, trying to get in some exercise, even if you're trying to socially isolate and stay away from people, but doing whatever you can to get up and move. And that's really hard for a lot of people who don't have a lot of ways of, say, getting out of their house if you've been exposed to the virus, for example. But whatever you can do along those lines is good. In social isolation, the important thing to keep in mind is that it's quality, not quantity. So what we know is that having a ton of friends and having all these interactions, having these Zoom parties or however you're doing that, having quick phone calls from all kinds of people, or sending out 1 million emails is not the way to do it. We know now that having a meaningful, emotionally connecting kind of interaction with someone is 100 times better than just having a quick conversation. So it's quality over quantity, making sure that having one friend that you can connect with in a very personal way and really share what is going on with you and listen to what they're experiencing That is the kind of interaction that really decreases social isolation. And we're trying hard at U of A to find ways to help older adults to connect with one another and to connect with organizations like amazing TMC for Seniors. It's not enough just to be on this chat, right, or on this the live streaming video that you're seeing today. I would really encourage you to reach out through Maya and others who you may have met through TMC for Seniors, and connect with people, one another, and talk about what's going on and help each other and support each other. That is absolutely the most important thing that you can do to overcome social isolation. You know, in my community, I know of 3 or 4 older adults who live very near me, and they are on their own. And so my husband and I have made a point to take our dogs for walks through the community and to connect with those people and see them just, you know, from a big distance, 10, 15 feet away, but to be in front of their front door and just have a conversation with them and ask them how they're doing. That means a lot to people. So I would encourage you, not only for yourself, to reach out and break that social isolation, but try to find others who you can do the same for. We're all in this together, and it's having a major impact on all of us. The other thing I wanted to just talk about really quick, I don't want to speak too long because I want to get to questions, but it's almost the flip side of social isolation. And because what we're seeing in COVID-19 in this whole pandemic is that people are spending a lot more time with media. So there's so much going on in the news, and not a heck of a lot of it is positive, right? All of the things that are going on across the country in terms of the pandemic and the financial situation and the social turmoil around race and ethnicity. All of these things are just, we are being bombarded with it. And we're seeing more and more that people are spending a lot more time online, a lot more time reading the news or listening to the news on TV with our smartphones. It's almost like we can't get away from those things. And that might seem like it's a good thing because you're staying connected, but remember a couple of things. One is that those don't count as personal, meaningful interactions. They may be very important. I'm not saying that, but they don't count as the kind of breaking down of social isolation that I'm talking about. The other thing that we know is that it actually increases stress. So you're actually adding another layer of stress by sort of overindulging in hearing what's going on in the world. And so I and my colleagues have really been trying to get the word out that it's okay to be unplugged, that it's actually good for you for bunches of time in the day, particularly in those hours before you try to go to sleep, to unplug. Don't go back and read the news. Don't open your laptop in bed or look at your smartphone. Don't do those things. The stress of just reading the news increases the likelihood that your sleep will not be good, but also being exposed to light that late in what we call the circadian rhythm. As you go through that cycle, that physiologic cycle that gets you ready for sleep, your body wants darkness. And if you bombard your eyes with light, it will actually affect your sleep, your ability to go to sleep, and also your ability to stay sleeping. Sleep is really important because sleep is the time when our bodies repair and the brain repairs itself. It's the time when we overcome the effects of stress of all kinds, including social isolation. So it's very important to maintain really good habits around sleep. Go to bed at the right time, at the same time every night. Be in a cool, dark room, and don't mess around with news and news media or any kind of media in the hour or two before you go to bed. Make that a sacred time that is just for you to calm down, take your mind off things that are going on around you, and have a quiet time so that you can really enter sleep. So I think I'll turn it back to Maya at that point, and I know we've had at least one question, and I'm happy to take questions from everyone.
Thank you, Lee. We actually have a couple of questions that have popped up that I think are really important that we address today. So one of them is about the type of exercise that works best for reducing long-term inflammation in the brain. Is it cardio? Is it strength training? What would your recommendation be?
You know, that is a really good question. We actually do not know exactly how these various kinds of exercise impact brain health. We know that, in fact, they are all good for you. There's been a lot more studies and press about cardio workouts. So, you know, stressing the heart by going for a brisk walk, for example. But we don't know actually that inflammation is the exact mechanism for that. What we do know is that all three of those are definitely good for you. So cardiovascular, going for a brisk walk. Strength training is super important, and because it builds bone and it builds muscle. And as you get older, you tend to lose muscle mass. So it's the thing that decreases falls, for example. And we know it has a good impact on the brain and on cognitive health as well. But we're not quite sure if it's through inflammation. So I would say that, and then balance is the third one. As you get older, you really need to do things that will help you to maintain that balance so that you don't fall. It's a really major concern as we get older. I like to say that the perfect exercise for older adults is hiking. You're on a trail, you're getting a cardio workout. If you're going uphill at all, you're actually doing strength training and weight-bearing training. And very definitely around here in Tucson, all those rocky trails, if you can do it safely, it really pushes the balance too. So my guess would be that cardio is the one of the three that has the biggest impact on inflammation, but we don't really have great evidence for that. It's a great question.
Good. Yeah, I enjoy exercising so much, and actually I've taken this opportunity since we have been isolating. I work out every single day, so I have to say it's been something for me. It's sort of my way of getting through some of the stress, I think, as well. It's a good stress reliever. So
it is, absolutely.
Yeah, so I definitely love that. What do you think? We had a comment here about missing human contact, especially with family. And, how do you handle if you choose to isolate, but you really miss being with everyone, and that's sort of what keeps them going. So I know that's that's definitely a challenge I think we're all facing right now, is you miss having that social contact with your family and your friends right now. And how do you move through that piece?
Yeah, the phone is okay. Zoom might, or other, the online might be okay, but there's nothing like actually seeing each other face to face. What we've tried to do is this kind of socially distanced personal interaction. I can't do that with my family. My family's all in Canada, so I can't actually even go there if I wanted to right now. But here in Tucson, we have, as I said, I've gone to people's houses in the community in and around us to talk to them face to face, and we stay 10, 15 feet away from each other. So we have these kind of chats from a distance. It really means a lot to see people face to face. And I know friends of ours have done the same thing, where we've actually gone to one of our yards or a park and sat 10 to 15 feet away from one another, wearing masks, of course. But I don't think anything can really take the place of that.
Yeah, I agree with you. You know, we have enjoyed since this time just to do our activity kits where it's a drive-through event and it gives us an opportunity to see people, but to safely follow our safety protocols. And I know that a lot of the people who have come through, a lot of our seniors, you know, it may be the only time that they're out for the week. But it puts a big smile on our faces and on theirs at the same time, because it's just that social interaction that they haven't had. So we love doing that as well.
Yeah.
So I have another question that came up, and it says, is there any difference between males and females in relation to inflammation, especially as it relates to the heart?
Oh my goodness, that is a great question. We didn't know this before, and I can't say about the heart, but what I can tell you about the brain, so I'm assuming it's probably the same for the heart. It does turn out that females are more likely to mount an inflammatory response in the brain. We don't really understand what that is, whether it's because of the hormonal changes that we go through as we age, but we know that females now are more likely to have certain kinds of changes in the brain that are likely to be associated with this kind of widespread inflammation. So it's even more important. It's important for all of us, but I think it's even more important for women to think about this and to maintain a healthy diet. You know, one of the things I didn't mention is that diet can have an impact on inflammation. If you have foods that you are sensitive to, I shouldn't be eating gluten. I'm not celiac, but I'm very sensitive to gluten, and yet I do it on a regular basis. Not super much, but because I love bread so much. But that drives inflammation in the system. And so switching to things that you know are anti-inflammatory. So what are those things? It's things like brightly colored fruits and vegetables, including cinnamon and garlic in your diet. You can look at websites that have whole lists of these things. And by the way, coffee and red wine. I like those ones. Everything in moderation, but thinking about diet as a way to decrease inflammation. If you kind of roll it all together, and you've probably heard about the Mediterranean diet, we do think that one of the reasons that it has a positive impact on cardiovascular health and brain health is because virtually everything in that diet has anti-inflammatory properties. So that's something to look up if you don't know a lot about that.
That's excellent. And, you know, coming up, we have over at TMC for Seniors, we're actually all these topics that you just discussed. Exercise was actually our activity kit for this month. Next month is Fall Prevention Month. So we will be doing a lot of focus on that piece as well. And in October, we're focusing on nutrition. So these are all great things that are coming together. And I love just the quality over quantity that you mentioned, Lee, because that is so important. I know that if you can make a connection with somebody for a few minutes, that can make a huge change for somebody. And I really do feel that that's an important piece that I think people may overlook.
Right.
We have I do have some comments here. It just says that they've left their apartments and that at their apartments there are no activities and everything has been closed down, and that they're isolated even from family. And so I know it's important for folks to find new ways to try to connect, whether it's, you know, whether they can go out or.
Right. And I said don't overdo it online, but actually I've had an amazing experience, not only working online, because that's where we're working right now, So I have many meetings with people face to face, but via Zoom. But I also ended up reaching out, and they reached out to me, to a couple of really old friends who live in Canada, who I have not actually connected with for a very long time. And so we're meeting regularly now by Zoom. And it's sort of, even though it's not face to face and we're longing for a time now, we're trying to plan for a time when we can actually visit one another. I must say it's really been a wonderful experience to reconnect with very dear friends, and be able to see their face. So we're all trying to figure out how to bring the world into our homes, right? And it is a powerful way to do it.
Absolutely. Well, thank you, Lee. I think that's all the questions that we have for now. But if you end up having more questions for Lee Ryan, please let us know. Please leave those comments on the YouTube or the Facebook page, and I will get answers for you that we can post as well. So if there's something else that comes up that you think about afterwards, you can certainly reach out to us, and we would be happy to see what answers we can get. Thank you again for being with us today. I am thrilled that we were able to have this opportunity to talk about this important topic. So thanks again, Lee. I appreciate it.
Thank you, Maya.